for joining. I'm sure there'll be some more coming along the way. This is our virtual social hour, which we started a few weeks ago when COVID-19 started, just to give the global tribe an opportunity to come out and chat and share. And, you know, it's been an interesting time for all of us. And so those of us that are global have a different perspective on the world. And so hopefully we're helping each other cope and adapt and thrive in this new reality. My name is Doug Brunke. I'm the founder and CEO of Global Chamber. I'd wanted to say, just literally 20 minutes ago, I got an email from a hotel that I frequent in Los Angeles, and I just wanted to quickly read this couple key points because it goes to the topic that we identified for today, which is back to work. And everybody wanting to get back to work, and in states and provinces and countries encouraging that. And we've got a couple speakers here that are going to address it from a travel perspective, but I wanted to address it from this hotel. It's called the Figueroa Hotel. Has anybody ever stayed there at the Fig in Los Angeles? I highly recommend it. My daughter got married in Los Angeles last year, and the wedding party stayed there. I've stayed there other times as well, but it's a hotel that was founded in 1926. So as in the letter, the lady who is the director for the hotel, they said they've endured the Great Depression, they endured World War II, they endured Great Recession, and they're going to endure this as well. They talked about staying open. They talked about frequent sanitizing of high contact areas. They talked about rigorous cleaning throughout the hotel. They are remaining open. They have a check-in kiosk that's both outside and inside that allows you to check in without touching people. They have minimizing elevator distancing. It's a very old hotel, so it's kind of a little bit smaller elevators, so they control people going in and out of those. And they do a lot of text messaging to people. They're donating a lot of food to shelters, in particular the Downtown Women's Center in Los Angeles. And they're promoting the concept and the program called Dining Bonds, which is a program to allow you to invest right now, and their employees who are in hospitality and in the restaurants, some of which are not open, are getting money because of those investments. And so there's a variety of things that they're doing that I thought were very interesting and probably a model for what a lot of organizations are doing around the world. I'd like to introduce Jake Rothwell from International SOS, who will introduce Dr. William Hauptman, and they're going to talk a little bit about travel. There's nobody in the world that knows international travel like International SOS, just like their name says. And so, Jake, thanks for joining us this morning.
No problem. Thank you, Doug. I'd just like to give a brief background on International SOS in case anybody on the call is not familiar with who we are and what we do. And then I'll kick it over to Dr. Hauptman to talk about, some of the medical implications associated with COVID and how it's impacting travel and, and business in general. So International SOS is the world's leading medical and security assistance company. We've been around for over 35 years. We have more than 11,000 employees. We operate in over 90 countries, and the infrastructure of our organization is operationally really driven off of our 26 assistance centers that are located around the globe. Dr. Hauptman sits in our Philadelphia Assistance Center, which looks after North and South America. And the remaining 25 are regionally positioned to look after, different areas of around the world. We're open 24/7 to take any sort of call from our members, whether it's medical, security related or logistical. And we actually have, I think, around 10,000 clients globally that we support. And among those clients, it's about 87 of the global Fortune 100, and I think around 69% of the global Fortune 500. So obviously, we bring a lot of expertise to bear for our clients. I think, and Dr. Hauptman can correct me, but I believe we have around 3,500 medical professionals on staff, and obviously that allows us to be an industry leader when it comes to providing thought leadership around medical issues. We also have over I believe about 1,200 security professionals that work for our organization. So we're able to support our clients from an integrated and holistic perspective when it comes to medical and security events. And the two are very often intertwined. Um, I think that is, I guess the last thing I would say would be that, given our significant client base and medical expertise, security expertise, this pandemic is obviously impacting everybody around the globe, but from a business perspective, we're seeing it impact different industries in a different manner. You could guess that hospitality, um, travel, transportation, education, um, entertainment are all being significantly impacted due to the fact that nobody can travel or hang out in large groups in public. But then, on the flip side, you've got our government contractors, which pretty much work in a recession-proof business, but it's proving that they're actually not as badly impacted by the pandemic as well, since the U.S. government is pushing out requests for a lot of work to support, whether it be FEMA or their contract work overseas, chasing criminals or, engaged in active war. Those private contractors are still in need and still conducting business. I guess unless anyone has any questions for me, which I'd be happy to try and field, I'll kick it over to the doctor for some insights from a medical perspective.
Sure. Good morning, everyone. It's really a pleasure to be participating in this virtual hour and to meet everybody electronically. I'm, again, Dr. Bill Hauptman. I'm a medical director in the Philadelphia Assistance Center, so I oversee our team of doctors and nurses in their provision of medical assistance to our members globally. And as you can imagine, International SOS has had a tremendous response, unprecedented response to the COVID-19 pandemic to support our clients, including figuring out our own business continuity plan so we can continue to effectively provide the necessary assistance. The first interesting, important point to make is that while we're very involved with COVID-19 and the medical implications of that and advising our clients, we're also very involved in continuing to support our usual expatriates and business travelers. While it is true that a lot of expatriates have come home and a lot of business travel has ceased, not all of it. And we find even more than before, our members who remained in their expatriate locations or our members who continue to travel have continuing needs for medical and security support. Anything ranging from arranging for a GP appointment in Rome for a sore throat to this morning before this call, I was involved in arranging an air ambulance evacuation of a member with a stroke in Fiji, bringing him to Australia. And both of those issues have their complexities. So we've been very involved with maintaining the safety of our members. Additionally, of course, we've been closely monitoring the COVID-19 pandemic globally. We have our medical information and analysis team, at least 15 experts globally who consistently are monitoring the situation together with really hundreds of medical directors such as myself and non-medical staff members and physicians on site to really be able to provide the best real-time advice and information to our members, which we've been doing from the onset of the pandemic, looking at the global activity of the virus, where the numbers are going up, where they're going down, what are the medical conditions of all the countries and the medical facilities. And, you know, as you can imagine, all of our expatriates and business travelers were used to, you know, if I go to a certain country in a certain city, if I get sick, this is the one go-to hospital that all the expatriates use that I feel comfortable in. Well, suddenly we're finding ourselves in a situation where that hospital may not be available. It may be closed, or they may not be seeing any patients with fevers. So we're providing an increased level of support to be able to guide our members to the best possible care when they travel, and even more importantly, to be able to maximize their care before they leave, so that we can mitigate against the risk of a medical or security event occurring while they're abroad. We're continuing to provide that travel advice and advice for people if they need to stay in their location, how to shelter in place, how to have provisions for 2 weeks, seeking medical care locally and optimizing the local care. But when necessary, we have been able to organize now many evacuations, some mass evacuations of dozens and dozens of people who were not sick and just needed to leave the location, but also other evacuations of illnesses, such as the one I talked about with a stroke out of Fiji, or sometimes somebody with a fever that's not COVID-19, or sometimes even patients with COVID-19 that we've been able to evacuate. And of course, we've developed particular expertise, having to leverage our on-the-ground knowledge, our resources and contacts globally to be able to do that, to understand the lockdowns in the different countries, the airport closures, the border closures. We're maintaining communication with the CDC, the European CDC, the World Health Organization, civil aviation authorities, embassies, government agencies, monitoring all of the closures and what's possible, so we could move patients as necessary for whatever condition may come up. And of course, as I said, it's been much more complex due to difficulty finding an aircraft and getting all the necessary permits, and even arranging receiving care. Very often now, if we would have evacuated somebody from Eastern Europe to Germany, Germany may not be accepting patients. So we need to work harder to find a receiving care hospital, and we need to understand even more how to maximize the care locally. We're also providing sort of telehealth solutions to our members while they're abroad, realizing that they may not want to leave their apartments if they're on or their hotel if they're on a business trip. Virtual consultations, telehealth, even psychiatric support telephonically. So we've been continuing to provide the usual support to expatriates and business travelers, now complicated by the COVID-19. But what we're seeing now, and what I think was what you were very interested in hearing about, is what are clients coming to us now to help them with the return to operations. Everybody's working from home, even in the U.S. What do they need to think about if they want to bring people back to their office? You referenced the Fig Hotel in Los Angeles. What do clients like that need to do? And actually, a lot of hotels are our clients, figuring out how we can support them return to operations. And then after that, how can we support people in, okay, now we've helped you return to operations in the US. How can we support you with a return to travel, to leave the country? So, clients now are really beginning to prepare for the next phase and beginning to rely upon us for this advice. And we see now with COVID-19, the numbers in a lot of locations seem to be decreasing, which is good, but everybody understands that in the fall, we're going to see a second wave. There are going to be increased numbers of cases, and it's going to be complicated because we're also going to see it with a seasonal flu, which is going to make it a little more difficult. The good news is that we've learned a lot over the last short several months, and we're, as a country, well positioned, and even globally in other countries, well positioned to respond through our public health infrastructure for this second wave with quarantining, isolation, contact tracing, and case tracking. But the key issue is that for operations to return to normal, companies, your member organizations, must have a plan in place. You have to have the ability to track COVID-19 activity wherever you operate. A state in the United States, a particular city, globally, you need to have access to medical and security alerts in order to really, meet your duty of care. You need to understand what are the local regulations for what we call the non-pharmaceutical interventions, or the mitigation measures that we've all been taking. What are the regulatory requirements, for instance, of point of entry screening? If you're going to be opening up an office or traveling globally, is there a requirement in this particular location to have a nurse sitting at a desk at the front door checking temperatures and taking a history? Is there a requirement location to location for personal protective equipment, wearing a mask? We know that the situation is going to absolutely remain fluid and dynamic. It's going to change constantly and unpredictably, so we need to be able to respond. Everybody needs to understand personal hygiene, hand washing, not touching certain surfaces, and if you do, you have to wash your hands, social distancing, and what the implications are for that. Everybody needs to be educated in all of those issues for a return to operations. What to do if somebody is sick in the office, how to respond. Do you have a plan in place to isolate them? How to advise an employee who calls from home and they're not feeling well? How to advise them that everybody should be educated, of course, not to come to the office. How to be prepared to clean facilities every day, and more deeply if there's been some infectious event there. So those are the things that we think about for the usual return to operations. And then getting to return to travel, I think in that instance, which we're really beginning to come upon, and our clients are beginning to ask us to assist them in this as well. This is an area where all of us must really fully embrace our duty of care before considering redeploying any staff, and we're actively consulting with our clients in that regard as well, determining the real need for this employee to travel, vis-a-vis the location that they're traveling to, and what their work is that they're going to be doing. Even more importantly, to fully evaluate and understand the destination, just like for return to operations in the US, but even more importantly, if you're going to be doing business travel to other locations, you need to have access to medical and security alerts to be able to have the intelligence to track COVID-19 activity wherever you might be sending people. You need to understand the local rules and regulations regarding masks and social distancing and quarantining. What are the regulatory requirements for point of entry screening? You also need to fully understand your destination. What is the local health infrastructure? What hospitals can I use? What hospitals can I not use? Are the hospitals, still overrun? Are the doctors sick and the nurses sick, or are they back at work? Are borders open or closed? Everything is constantly changing and needs to be evaluated in real time. Employees need to be fully educated before they leave on hygiene and the local regulations and the office regulations, what to do if they get sick. And then finally, even more importantly, I always preach, an ounce of prevention is worth a pound of cure. That even before anybody left on an expatriate assignment or on a business trip, you must optimize your care before you leave. That's the most important thing to mitigating your risk, that you don't have a heart attack or an asthma flare if you're traveling to a location with poor air quality. Now more than ever, that's critical, because we know it's going to be more difficult to access local health care, and more difficult to evacuate your colleagues if they get sick in some of these remote locations. So those, sort of in a nutshell, are the different areas that we think about, the business as usual maintenance, the return to operations, and then to return to travel. And I've sort of tried to outline the myriad issues and concerns that that we review with our members, and offer them consulting solutions that would be bespoke to their particular circumstances. Thank you.
Great information. You mentioned about the concept of finding out real-time information and wherever you are. How does somebody do that? Chris Herring, you just mentioned, in your message to me, is there an app you go to find that out? What's the process that anybody does that, or is it through you guys?
There are, go ahead, Jake. Well, I'll go first quickly, then I'll leave it to Jake. Optimally, it's through us. We have a lot of information that can be reviewed on our member portal, reviewing the travel information, reviewing the various alerts for your destination, as well as reviewing the pre-travel advisories. And if you have the alert and if you're signed up for the system, you will continue to get real-time alerts specific to your travel itinerary while you are abroad. So that would be the main way that I think of. Jake, you can certainly add to that.
Yes, sorry, with just coming off mute, and I'm actually going to paste into the chat section. We have a dedicated COVID website, and well, I should have started. So on the website, there's information that is open to the public, and there's information that is open to our members that subscribe to certain services. So we would recommend, individuals can look at that website and access the public information, which is fantastic. But as an organization, we are a membership organization, generally business to business. So, our clients are, we've run the gamut of every single industry in terms of our client base, but there is a structure in place where we have a membership fee that our clients pay annually, and then they have access to all of this information and advice, can call the Assistance Center 24 hours a day, 7 days a week, 365 days a year. We do have an app through which alerts can be sent regarding medical and security events that may impact a traveler. It has a lot of functionality. Obviously, right now, with very few people traveling, you're not going to gain all the functionality of the app, but it still you can access a ton of information through the app on pretty much every country on the planet. And I think we're around 850 cities that we report on as well around the world. So there are multiple channels to access the information. But, that said, we are a membership-based organization, so not everyone has access to everything that we can push out. Okay.
Well, yeah, I saw the link come up. Christopher, did you want to ask any additional questions or do a follow-up? Oh, you're shy this morning? For one day, you're shy? What in the world? Hey, by the way.
No, I'm not shy, Doug. I'm not shy. In fact, I think that the presentation was great in terms of the information. And then I was just looking and thinking about, this is really the time where true entrepreneurs become entrepreneurial. When we're seeing these areas such as travel alerts based off of pandemics or weather or other types of things in which we should all be focused on. I mean, we have a business world culture that needs to be helped. And so I'm glad to hear that this company does have some solutions that can help our business travelers, because everyone wants to have a sense of confidence moving forward, and then transparency. So if we have the information, we can make good decisions. When we don't have information, then we're very shy about what we want to do as business people. So I think it's just it's a great conversation, and I'm looking forward to seeing what's available in terms of the app that we were talking about, and I guess where there isn't something that's already been created, then I think that's the space where other people can create and bring value to the conversation long term.
Yeah, absolutely. By the way, Christopher, Iwana from the Seychelles is on the line. She's not shy either, but she did say she just listening in just to check it out. So, in terms of travel, we just did an event a week or two ago about international travel, and the data shows, or at least then, was down 96, 97%. So really only 3 to 4% of normal travel is happening right now. What do you guys see going forward? You know, does May 1st or next Monday signal suddenly an uptick, or is there a point in the future where we'll start to see that and a lot more people travel?
I think what we're seeing now is not any major uptick. I think what we're going to see is going to be more gradual. I don't think it's going to be May 1st. We're anticipating more over the summer when the numbers continue to decrease. Just in talking with our clients, when they're beginning to anticipate considering a return to business travel. So I think maybe more come June and July, we're going to see an increase. And then it will be very interesting to see what happens in the fall, because, you know, it's quite possible that I referenced that at the beginning of when I was speaking, the likelihood of a second wave in the fall. And it's quite possible that we're going to see an uptick in business travel over the summer, and then it's going to wane a little bit in the fall. And then hopefully once we have improved better treatments, proven treatments, and a vaccine, then at that point, I think we're going to see a more rapid uptick, as you referenced. And now there's talk of a vaccine as early as January. So I think that may be the time frame for a very rapid uptick. But before then, we are certainly going to see incremental increases.
Okay, great information. What other questions do people have? Just unmute yourself and go for it.
So Jake and Dr. Hauptman, thanks for joining today. I was just wondering about, I know you work a lot with oil, gas, and mining industries. Where are those in the essential type of categories for industries? Are most of them around the world working? They kept working during all this time?
Yes. So I actually, right now, I'm the director of account management for the Mid-Atlantic Southeast region. Prior to this role, I actually was focused specifically on our EPC clients, which is engineering, procurement, and construction. So my background has spent a lot of time focusing on the oil and gas industry. They have continued the vast majority of their operations during this time. As you indicated rightly, they're considered an essential service, you're an essential business. And oftentimes, you know, they're working with governments on, you know, not only specific oil and gas projects, but infrastructure projects, utility projects. So they're absolutely considered essential. They too have reduced their travel. However, you know, they maintain a lot of expatriate population around the world at different project sites. One of my clients indicated that they have not ceased any of their operations when it comes to specific projects. Offices definitely have you know, reduced their working from home. And, you know, I think it's going to be a case-by-case basis in terms of when they come back to physically, you know, going back to the office. Obviously, one of the issues with this whole problem, with the whole pandemic, is that in the U.S., we have no central point of control. You know, every state is powered by the governor and their decision in terms of how they're going to handle when they reopen. Which I think personally, I find it a bit frustrating. I think, you know, if you look at other locations and other countries where at times previously we might have thought they might not have as much freedom and liberty as us, that mindset of, you know, understanding and listening to the governmental mandates has actually benefited a lot of countries during the pandemic, where, you know, in the US, you see that in Annapolis, there was a protest, I think last week or 2 weeks ago. Michigan, big protests. You know, everybody loves their freedom, but it's a bit frustrating for me that, you know, we can't all come together and understand the importance of the fact that we are actually in a medical crisis, and we should, you know, not focus on yeah, certain aspects of our liberty. And I wish that the president, you know, took more control right now. Obviously, you know, one of my clients, they're saying their offices in Houston are going to open next week. Georgia has reopened to a degree. Florida has reopened to a degree. I think, you know, the lack of control is going to actually negatively impact the cases that we're seeing on the decline. But yeah, the oil and gas industry, I think actually the price of oil has hit them harder recently than the pandemic.
Hi, this is Dr. Hauptman, and just to give the view from the Assistance Center, I can tell you that we are continuing to provide significant support to our oil and gas clients. A lot of them have remained on location on project sites, and we're continuing to provide advisory support for general medical conditions, as well as, of course, COVID-19, and we're continuing to provide local health assistance as well as evacuations for COVID-19, as well as other medical conditions. So that sector has continued to work and continued to work in their expatriate, more remote locations.
Fantastic. There's a question on the membership that you mentioned. You guys are members of Global Chamber, and then you talked about membership for companies. Well, how does that range? What does it look like for probably small, medium-sized businesses? Typically, is what we're dealing with.
So we have a couple of different, you know, tiers of membership. What we recommend is our newest offering called our Travel Risk Management solution, and it contains various different products and services that help us support our clients and help them meet their duty of care. At the very on the most basic level, our membership is based around comprehensive medical and security membership. So what I referenced earlier about having the ability to call into our assistance centers and speak with a doctor or security professional at any time, that, you know, to have access to information, advice, and referrals. That's really, you know, the most basic portion of our membership. And then under this solution, you also have access to digital tools. We have what we call our travel tracker, which right now is not seeing a lot of activity because obviously not a lot of people are traveling. You have a branded portal where you can upload information for your employees, connect to HR feeds, and have access, as I referenced earlier, to our country guides and travel security online, which is a wealth of information on the medical and security landscape of pretty much every country on the planet. And like I said, 850 cities. You have access to emotional support through our membership. We partner with an organization called WPO, and so our members have the ability to call in to the assistance center, and if it is identified that they are requiring emotional support, we are able to get them on the line with a counselor. We can even do on-site visits. Obviously a little bit more trying right now, given border closures and, you know, lockdown restrictions. And there are various levels in terms of pricing, and it's all dependent on the number of lives you would like to cover under the program. So obviously, I think one of our smallest, memberships is probably around 10 people. and then, we go to covering organizations that have, over 100,000 employees. And
Okay.
so it really runs the gamut. But I'm happy to, have individual conversations about it. If anybody wants to ping me, I can put my email address in the chat.
Are you based out of Philly or Maryland? Where are you?
I am based out of Maryland.
Okay.
So the lockdown hasn't been that different for me because I work from home
Okay.
all the time, but usually I do travel to see clients, and obviously I haven't been doing that.
Okay, and they're state of Maryland with the governor Hogan, right? Getting
Yeah.
a test from Korea because his wife's Korean, so it's very, very
Yes.
entrepreneurial of them, isn't it?
Absolutely. And
Yeah.
we have individuals based all around the United States, obviously all around the globe, but if, folks are located in different regions, I can put you in touch with the appropriate individual to speak to, depending on what region of the country you're in or where you
Great.
are globally.
One last question for the good doctor, because I know you're very busy. The question is more around your level of optimism or pessimism about what's coming next. We as the U.S. anyway, we kind of rely on Dr. Fauci to cut through a lot of the facts of what's actually happening, and so what's actually kind of from your medical expertise perspective. You talked about an uptick in the fall as well. I mean, should we be optimistic? Should we be pessimistic? How should we approach the next, through the vaccine potentially in January? How do we approach this time?
My approach is always to be cautiously optimistic, and Dr. Fauci is everybody's favorite uncle these days. Really, whatever he says, I think you can take to the bank. There's a lot that we don't know, and there's a lot that we've learned over the last several months, an incredible amount of information, but there's a lot that is still unknown. What will the future of the virus be? Remdesivir has just been shown to be an effective treatment. I think it reduced the hospital stays from 15 days to 11 days, which is, from a clinical point of view, very, very significant. And also from a proof of concept point of view, critically important, because now we know that it is possible to have medications that impact the function of the virus. So that piece of information, I think, should heighten our optimism that this is something that we can control, because one of the main issues with the virus is the peak in the number of cases risks overwhelming our healthcare infrastructure. Everybody's heard about flattening the curve, and that's why we need to do social distancing so that we can not have a peak of cases all at one time that will overwhelm the healthcare system. We can spread it out so that health facilities will be available to everybody who needs it. Well, now having a medication greatly facilitates that, because as you can imagine, it will reduce the number of patients who might need an ICU. It'll reduce the number of patients who might need a ventilator. And that means that patients can more effectively be taken care of without a fear of overwhelming the healthcare system. And that means that we don't have to be quite as nervous about the flow of cases. The other information that we're learning is the results of, there were two kinds of tests, and it's worth sort of parsing it out just so that everybody understands it, because it's an area of frequent confusion. There's the swab in the nose and down the throat. That's the Pcr test, polymerase chain reaction. And that looks for actual viral particles. We're looking for the virus RNA. The other tests, the blood tests, the serology tests, the IgG, the IgM, that's not looking for the virus. That's looking for the body's immune response to the virus. So with both of those different tests, there's a lot that we've learned, but there's a lot that remains unclear. For instance, how long will the viral particles remain in the throat if we get sequential swabs from somebody's throat over the course of days and weeks after they've been tested? And I can tell you, you know, some patients that we've had abroad who were tested positive for COVID-19 and treated, 3 weeks later when they wanted to leave the hospital, they had sequential testing. And we had one patient whose tests were negative, positive, negative, positive, negative, positive, negative. So it was quite frustrating for us, and one can only imagine for the patient. So there's a lot we're learning about what it means to have a positive test. Is it just broken viral particles, but you're no longer infectious and you can leave the hospital? How do we interpret that? And of course, that has very large public health implications. The other tests, the serology testing, the IgG and the IgM, the big question is, well, does this then confer protection upon the person who has these antibodies? Usually, when we do a test and we find antibodies, they are protective. And we expect that to be the case with COVID-19. But it begs the question, is it going to be protective forever? Unlikely. For a few years, hopefully. For a year, maybe. For a few months, well, maybe as little as that. So there's a lot of studies that are going on, and we're learning a lot and we're getting a lot of data. And I think the information that we're learning enables us to be cautiously optimistic that that we're going to get a handle on this. And you know, it's worth mentioning also that pandemics historically have always come and gone. You know, everybody's learned now about the Spanish influenza pandemic of 1918. Well, that came and went. So, you know, I think we can be 100% sure that this will go away. The question of optimism really speaks more to what time frame are we looking at. And I think that answer is informed by understanding the testing that's done, the PCR from the throat, the serology from the blood work, as well as understanding the medical treatments that we're looking at, as well as understanding our enhanced public health measures. So putting all that together, I am by nature optimistic, and I will remain so in my view of this pandemic.
In the interim, there seems to be a wide variety of response. And just as a quick examples, there's a bakery in Metro Phoenix I go to. You must wear a mask when you enter. They give you a glove when you do the credit card. Everybody in the kitchen that you can see has a mask on. Everybody, every employee. That contrasts that with, I've also been purchasing a vehicle this week, and all three dealerships, Toyota, Buick, and Jeep, not a single person, not the receptionist, not the salespeople, not anybody at any of the dealerships have a mask on. So how should we be responding to that?
I think that the prudent public health recommendations are widely known and widely promulgated. You can Google the CDC public health recommendations, and it talks about social distancing, and it talks about wearing masks. And I think in my view, as a physician, any enterprise that flouts those recommendations that are not just for the good of the individual in that circumstance, but they are for the good of the entire community and the entire nation when handling a pandemic. I would not be happy with institutions that flout those recommendations, and would bring my business, if possible, to places that are more in line with maintaining the public health recommendations.
Got it. Very good. Well, are there any other questions?
Doug, I have a question for you. So are you looking, do they have good deals right now, given the pandemic? Because I'm considering to look for a new vehicle right now, because I think it might be a good time to save some money.
Yeah. Yeah, but by the way, this N95 is courtesy of Cesar Trabanco. Thank you very much. So actually, the car deals are not that great because part of the problem is many of the U.S. and most of the global car dealers, the manufacturing's been shut down, right? So they don't, even though they don't have a lot of cars, there's not a lot of people buying, and so they haven't gone into the sales mode. And so I actually delayed my sales purchase, hoping that things will get better in May when they figure people are coming out and now they're going to entice them. So I'm hoping to get a better deal in May. So we'll see.
Oh, good luck.
But the fact that every one of them doesn't do it, I don't know what to do given Dr. Hauptman's thought of, don't go to the places that are flaunting these things. Where do you go? So if anybody knows any automotive manufacturer dealers that actually follow the rules, let me know.
Yeah, I know. I'm sorry if I got particularly cranky, but it's something that I feel strongly about.
No, it boggles my mind. The guy at Jeep, he said, why don't you take it for a ride? And we seem to be having a social distancing thing going on. And then he jumps right into the passenger seat and is like showing me all the stuff. It's like, dude, wait a minute. It's like, let me get out of here. It's like, this is not acceptable. So we didn't go on a ride that day. So I can see how you can be cranky for sure.
Yeah.
This is our safety. This is our health.
No, absolutely. Just want everyone to be well.
Exactly. Well, thank you so much, both of you, for taking the time today. We really appreciate it. Great information. Thank you. And you're free to leave now. I know, Dr. Hauptman, you've got a lot of things, but we're only going to go on for another 10 or 12 minutes and just kind of cover any other topics that we have from anybody else. What else is going on? Anything else? Or have you been inspired for some additional thoughts given what Jake and Dr. Hauptman mentioned?
I have a question, Doug, and I want to take the opportunity that we have Dr. Hauptman here. Where does weather falls in all this? Like, hot weather, is it like a really
That's a good question.
proof that there's less opportunity for everyone to get infected, or how's? I mean, you can see my background, and I could be there, I could be there right now, but our beaches are closed because, of course, of the fears of how fast the virus can spread. So we got like 90 Fahrenheit degree with 105 humidity feeling. So I'm asking just where science falls on that.
That's a great question and something that's been looked at. Maybe I think right now, while it is true that a lot of viruses activities seem to wane in not just hotter but more humid climates, there's no specific evidence now that would be the case for COVID-19. And in fact, if we look globally, when the pandemic got started, we really have not seen any evidence that countries near the equator with warmer climates, with greater humidity, have been preferentially spared the effects of the pandemic. The one thing that is true, of course, is that typically, and part of the reason that we see less flu during the warmer months is that people are outdoors and people aren't on top of each other the way they are during the colder months. And it's really speaks to the public health admonition for social distancing. When it's warmer, it's easy to social distance. Everybody's outside, we're riding our bikes, we're keeping far apart from each other rather than staying huddled inside. So that could potentially be a byproduct, but there's really no good evidence that the warm weather or humidity per se directly impacts viral replication.
Thank you.
Got it. So Cesar in Puerto Rico and me in Arizona, we're not safer then, it sounds like.
Seems like, yeah.
Oh, well.
But if you're wearing your mask, you are when you go for your car.
and you're not at the Toyota dealer. Yeah. I got you. So any other questions?
Hey, Doug, this is Ryan Sachs. Just a quick question for the doctor. So especially, I'm in Tennessee, And they've given, props to the governor for just the ample amount of testing and saying, in order to go back to work, you are going to have just, ample amount of testing and be able to test your employees daily, weekly. I mean, is that feasible? Like, I mean, is that really the way this is going to have to happen for us to go back to work?
I think that's a great question. And ideally, having access to testing will be a great tool for having people go back to work. For instance, if we can, now of course, again, I talked before about the two different kinds of testing, the throat swab and the serology testing. In the absence of symptoms, outside of a study, I think it would be more unusual to have a throat swab just to confirm that you don't at that point have the virus. Because while I referenced earlier that the viral particles can remain in the throat for a long amount of time, typically most recent studies have shown that the viral particles in the throat are at their greatest, unfortunately, about a couple of days before you're symptomatic, which leads to the conclusion that everybody's infectious before they even have symptoms. And while they can last typically up to 21 days, if not longer, usually by 7 days, they drop dramatically. So it's unlikely that a return to work is going to be predicated upon negative swabs, although that might be done if the numbers of tests available allowed that. Alternatively, the best the best option would be that we determine that the serology testing, the antibodies, the IgG and the IgM, we determine that they do confer upon you a degree of immunity. Then we could understand that the number of people in the country who've had COVID-19 is at least 10 times, if not 20 or 30 or 50 times greater than the number of people that we know about. Because many cases, more than we even thought at the beginning, are asymptomatic. They have no symptoms at all. So it would be very useful if we could determine that the presence of antibodies confers upon you immunity. Then we could test everybody and say, oh, look at that. Lo and behold, you had it. You never even knew you had it. And now you're safe. You back to work. And then somebody else who's never had it and they don't have the antibodies, we may have more prudent, careful recommendations for that person. But I think once the testing becomes available, in concert with enhanced hygiene measures, social distancing, screening at the door, in concert with all of those public health and mitigation measures, will be some sort of testing when the availability of testing allows that.
And I'd just like to add on to that. We actually do have a division of our organization that's called our med supply business. And we actually, are able to sell the rapid test kits, PPE, pretty much everything people are looking for related to COVID. We are also doing screening and testing for some of our clients at different locations around the world. But when it comes to the PCR that Dr. Hauptman referenced, nobody can get that except for the government right now. They're being built as ordered and they are backlogged. I think they predict that they won't be able to sell to the public until the end of the year or something.
Wow. Is there also, I've heard that there are false negative tests that come back. What's your experience with that?
Yeah, no, well, the false negative tests, are you referencing the nasal swabs looking for the viral RNA, or are you referencing the serology blood tests? And actually,
swabs.
The swabs. Yeah, no, absolutely false negatives. And as you can imagine, it's going to be predicated upon the technique with which the sample is obtained, how well the swab is used. Additionally, it's going to be predicated upon the viral load that that the patient has. If somebody is infected but with just a minimal inoculum, then any testing that's done is going to depend upon sampling error. And you may have a false negative because, well, there's virus there, but there is so little there and only in a few locations that the location where I happened to plant my swab didn't pick up any of the viral particles. Also, where the swab is located. Unfortunately, because it's more comfortable, but deeper down in the nasopharyngeal passage, you're going to find greater amounts of viral particles. So was the swab placed as deeply down as possible? That speaks to, you know, operator error or talent. So it's the load of inoculum, the amount of the virus, the technique with which the test is done, that could all influence that could all result in false negatives. And it can also be the timing in the course of the disease. You know, early on, you know, which is not unusual for viruses, 2 days before, up until just about the first day of symptoms, you have your highest viral loads. Well, a lot of people are going to be sick for 5 days and then present for symptoms when the viral load will already be decreasing. So we will have missed the opportunity to test them when we would have the greatest opportunity to get a positive test.
Wow, that's fantastic.
Hi, Doc. I have a question for Dr. Hauptman. This is Indira Jeffrey.
Hi, Indira.
Hi. Well, actually, two questions. One, the first one. How true is that when you have fear, your immune system lowers? And, you know, with all the communications around and, you know, the fear of the pandemic, how true is that, you know, someone is more, can be more affected for the virus if they have this fear to the virus? I don't know if
No, that's a great question, and maybe more of a theoretical question. But we do know that when patients are under stress, there are certain hormones and chemicals released in the body, cortisol, other glucocorticoids, and those chemicals can impact negatively the immune system. So, you know, it is possible that under a severe amount of stress with elevated levels of those hormones, your attack of an invading virus might not be as effective. But I would caution that that's really more of a theoretical answer. And in terms of the medical literature, I do not know of really any proven studies that would demonstrate that.
I see. Okay, in the second one, I have two little kids, 5 and 7. But I haven't, I know that, for example, in Arizona, we have the order to stay home until May 15. So it looks like everybody's going to go back to classes in August. This is what I think. I'm not sure yet. You know, kids, they don't listen. So, and I've seen when I go pick up my kids, you know, kids that are coughing on each other, even though, you know, that's the parents or the teachers also, they are very strong on, you know, cover your mouth and all that. So do you know if, like, for example, the Department of Education are taking like, or training the teachers, or they are taking measures, you know, like some kind of measures to the schools so they can be more prepared?
That's a great question, and honestly, I don't know, and I think the answer would vary, you know, city to city, school district to school district, but certainly, I think it would behoove you to learn more about what measures are being taken place, are being put in place before you send your children back, and you might even want to consider observing for a few days to see exactly, you know, what's taking place before deciding to leave your children there. It would surprise me if in any location students go back to school as early as May 15th, but I've been surprised before, and anything's possible.
Okay, thank you.
Oh, you're welcome.
We have come to the end of the hour, so we do need to end it here. So Dr. Hauptman, our own Dr. Fauci, right here. In front of
Oh, God. That's the biggest compliment I've ever received.
if I wasn't looking at the screen, I could imagine him saying exactly everything that you just said in such a thoughtful and
Well, thank you.
learned way. Thank you so much for everything you shared today. Thank you, Jake, too, for bringing Dr. Hauptman and for your information. If anybody needs information and you're not able to get it on International SOS, let me know, and happy to get that to you. Thanks, everybody. Have a great rest of your Friday and great weekend.
Yeah, enjoy the weekend.
Stay safe and healthy.
Yes.
Thank you,
Bye-bye.
everyone.
Bye.
Thanks, Jake and Dr. Hauptman.
No problem.